Hello everyone, my name is James Sellers, and today I will be presenting my research proposal titled Implementing a No-Fly Zone During Shift Changes, Increasing Patient Satisfaction and Safety. This proposal is part of my work in NU570 Research and Foundations for Evidence-Based Practice at Baker University School of Nursing. The purpose of this study is to implement and evaluate the impact of a no-fly zone, a designated 30-minute period during shift change from 0645 to 0715 and 1845 to 1950. During this time, patient transfers are restricted so that nurses can focus on giving and receiving report without distractions. This initiative is designed to improve the quality of communication and promote patient safety as well as patient satisfaction. Shift change is one of the most vulnerable times in patient care. It's high risk for communication errors, miscommunication, interruptions, and just cognitive overload during these periods can lead to preventable errors, which causes adverse outcomes sometimes. The literature supports uninterrupted, structured handoff practices as essential to safe and effective care transitions. The no-fly zone allows nurses to conduct person-centered handoffs without distractions from patient transfers or other new tasks that may be coming in. Studies by Buckho and Tsai in 2020, Stammer in 2014, and others demonstrate that structured handoffs reduce communication errors and improve outcomes. Stammer in 2014 talks about using an iPass tool to help reduce errors, which reduces adverse events. And then Bergner and Hebedelli in 2020 and 2022 talk about structured handoff interventions to improve patient safety. Jeffs et al. In 2014 showed that patient satisfaction increased with bedside handover. Armanin and Al-Nobi in 2022 showed that collaboration strengthens safety culture. Additional research shows that psychological stress and poor communication during transitions negatively affect both patients and nurses, and that's why implementing a structured system like the no-fly zone is not just beneficial, but could be necessary. The study is grounded in Imogen King's theory of goal attainment. This theory emphasizes that mutual goal setting and communication between nurse and patient, or in this case, between nurses, are critical for achieving quality outcomes. The no-fly zone supports this theory by creating an environment where clear, uninterrupted communication fosters a shared understanding of the care goals for our patients. Our three key research questions are: 1. Does the no-fly zone improve handoff communication? 2. Does it impact staff perceptions of patient safety culture? And 3. Does it improve patient satisfaction after it has been implemented. We hypothesize that the answer to all three of these are yes. Handoff communication and quality will improve with decreased distractions and structured communication. Staff will report enhanced perceptions of patient safety, and patient satisfaction scores will increase post-implementation. This is a quasi-experimental study using a pre-test, post-test design. We will compare outcomes before and after the no-fly zone is implemented. This design is well suited to quality improvement work, and while convenient sampling has some limitations, it will still allow us to draw meaningful conclusions. The study will take place at Stormontville Health in Topeka, Kansas, on the Spine Center, Joint Center, and Transitional Care Unit. We'll include RNs and LPNs who have worked on the unit for at least 3 months, so they are done on orientation and routinely perform handoffs during shift change. Our sample will be approximately 60 nurses that work both day shift and night shift. There would be some exclusion for float staff or other people that may not know about the no-fly zone and therefore not able to accurately participate. We will use 3 instruments to help the study. The handoff evaluation survey to assess communication and confidence during handoff. The Speak Up Stormont Safety Culture Survey to help gauge perceptions of teamwork and transitions, as well as any concerns with patient care. And then 3, Press Ganey patient satisfaction scores focusing on communication and care transitions. All of these tools will be validated and have a good, strong reliability. In this study, the no-fly zone is operationally defined as a designated 30-minute period during shift change, either 06:45 to 07:15 or 18:45 to 19:15, when no patient transfers are permitted. This allows nurses to conduct an uninterrupted patient handoff report. Communication clarity refers to the nurse's ability to clearly and completely share patient information during handoff, as measured by responses on the handoff evaluation survey. Patient survey is defined as and by staff perceptions of a culture that supports safe practices and communication, which will be assessed through Speak Up Stormont Safety Culture Survey, as it will measure adverse events as well. The study will be conducted in 3 phases. Pre-intervention, months 1 through 3, where baseline surveys will be completed, data will be collected, and staff will be educated. Focus groups with leadership will occur to talk about the practice and the support through education. Intervention will be months 4 and 6, where we implement the no-fly zone. with nurse managers monitoring compliance and reinforcing the practice. Post-intervention, months 7 through 12, administering surveys again, collecting updated patient satisfaction scores, survey scores, and holding focus groups with staff and leadership to see how things are going. All educational materials and tools would be saved and be available to help support replicability. If the no-fly zone proves successful, we could advocate for hospital-wide implementation. This would standardize a critical aspect of nursing practice that impacts safety, satisfaction, and communication. The evidence from this project could support broader policy development at Starmontville and beyond. Implementing a no-fly zone can help improve that communication, strengthen culture safety, increase patient satisfaction, and foster a safer and more collaborative clinical environment between team members. In conclusion, the no-fly zone has the potential to address a problem in healthcare. Disrupted handoff communication by providing structured and protected time. This intervention is low cost, easy to implement, and backed by evidence. Thank you for your time and attention. These are the references utilized in my proposal.